So what do we know now about how susceptible kids are to the coronavirus? How concerned should parents be? We are joined now by two pediatric infectious disease specialists, Dr. Jacqueline Wong and Dr. Fatima Kakar, to answer your questions. Thank you both for joining us. And Dr. Wong, let's start with you. In the first wave of the pandemic, we saw fewer cases of COVID-19 reported in kids compared to adults. Is that what we are still seeing now?
Yes, fortunately, that's still the case. It appears that children make up roughly 10 to 15% of cases, depending on the age cutoff that is used. So, for example, our national data indicated people 19 and under make up about 15% of cases. And then here in Ontario, people under the age of 20 made up about 13% of cases.
And Dr. Kakar, at your hospital, what are you seeing in terms of kids?
So to translate that into numbers, so at any given week, we have maybe anywhere from 1 to maximum 4 children hospitalized for COVID. And this is compared to the hundreds we actually have right now among adults in Quebec. And what's also interesting is that half the time those kids aren't actually hospitalized for COVID. So they're all screened on admission, so they might come in for a fracture and appendicitis and we're finding COVID. So even if it's 1 to 4 kids, half of those aren't actually there for COVID.
Okay, interesting. Let's go to a video question now. It's from Derek Lofoon. He is asking what a lot of us are wondering about when it comes to kids. Have a listen.
My question is, why are children more symptomatic than adults when it comes to COVID-19?
So, Dr. Kakar, before you answer the why in Derek's question, is this the case? Are kids more asymptomatic?
He is right. So kids are more asymptomatic, and even if they're symptomatic, they're mildly symptomatic. So it's very different from the symptoms that we're seeing in adults who have really severe lung disease. And so the question of why, we're learning more and more, but I think two things have stuck out now since we've evolved. The first thing is that kids seem to have less of this receptor we call the ACE2 receptor, which the virus needs in order to get into your cells to do its damage. And then the other thing is that the response to the virus, so the inflammation, is what's causing all of these symptoms in adults. And kids tend to have less of an inflammatory profile, so they're mounting less of a severe response. So that's why they're not getting the same level of symptoms as adults.
Okay, it makes sense. So right now, as you both know, lots of people are worried about the risk of schools reopening. Even kids are worried about that. So here's 5-year-old Eliana.
Is it too early to go back to school in Ontario?
Okay, good question, Eliana. Dr. Wong, what are your thoughts?
This is a very important question, and many of my patients have asked me the same thing. So similar to many countries around the world, in provinces where schools have remained open, they have not seen a spike in case counts as a result. So consistently, we are seeing that school reopenings do not contribute significantly to community transmission. When cases are identified in schools, they likely represent what's already going on in the community. So yes, I believe opening schools in Ontario can be done safely, especially when we follow public health principles like staying at home when sick, encouraging physical distancing, practicing hand hygiene, and wearing masks in proper situations.
Okay, Dr. Kakar, sorry to interrupt you there.
Okay.
Lots of conversations are happening right now about these variants of concern, the suggestions that these mutations are game changers when it comes to COVID. And I'm just curious, Dr. Kakar, what your sense is of whether they actually change the risk for kids.
So with these new variants, the biggest concern is their transmissibility. So we know with a lot of these new variants, they're going to be more transmissible. So what's going to happen is if they do become the predominant strains, we're going to see more cases in the population, which means more cases in children. But the good news is that they don't seem to be more severe in children. So if we look, for example, at the UK that's had this new variant for months, yes, there are more cases in children, but they're not more severe. So they're not getting more hospitalizations or more adverse outcomes. So the game changer is that it might be more easily spread in places like schools and in workplaces, which means more cases, but not more severe cases.
Okay, and in terms of vaccine timelines, especially for little ones, again, another question, let's have a listen.
My name is Sydney and I am 9 years old. My question is, when will the vaccine be ready for kids?
Right to the point there, Sydney. Dr. Wong?
Thanks for the great question. So after you get a vaccine, the the body makes antibodies, and these are needed to fight the virus and protect you from getting COVID-19. So vaccine companies have already shown that this works in adults, and that is why they're getting the vaccine first. The companies are now asking children 12 and older to participate in studies where they get the vaccine, and then they get tested to see if they make the same number and type of antibodies as adults do. It will take a number of months before these vaccines are finished, these studies are finished, and all the information is analyzed. And then for younger children like yourself, we might need different types of studies to inform us about what is the right number of doses to give you. These companies also have to make sure that children who get the vaccine don't have too many side effects and are protected from COVID-19. So the bottom line is it's still going to be a number of months before it's your turn.
Okay, fair. And I guess in the interim, one last thought to you, Dr. Kakar. What can you offer to parents in terms of understanding what they can do to sort of help alleviate both the stress and the real physical concerns?
So I think the first thing is I really want to reassure parents about COVID in children. So in a worst case scenario, even if your child gets COVID, and now we've had thousands, and in my hospital we've had hundreds, the disease is really mild. And I know people are worried about their newborns and their infants, and really the children are fine within 24, 48 hours. So the first thing is to not panic as much as if you're in a vulnerable group. The second thing is to know that all of the measures that people are taking, the hand washing, the distancing, are really working well. We have virtually no other respiratory illnesses, no coughs, colds, and flus circulating. So these measures work. It's just a matter of keeping them up, even though we're tired and people want this to be over. It's really continuing what they've been doing because these things have really worked well.
Fantastic. Your patience, your insight, Dr. Wong, Dr. Kakar, thank you very much.
Thank you.